Hello everyone, my name is Sakshi Bhoir, studying in final year B Pharmacy in Shivajirao Jondhle College of Pharmacy, Asanga. Today I am going to explain about the topic antidepressants, guided by Professor Manjusha Sanap. Depression. Depression is characterized by symptoms like sad mood, loss of interest and pleasure, low energy, worthlessness, guilt, psychomotor retardation, change in appetite and sleep, suicidal thoughts, etc. It may be unipolar or a bipolar disorder in which cycles of mood swings from mania to depression occurs over time. Antidepressants. These are the drugs which can elevate mood in depressive illness. Classification of antidepressants. First, reversible inhibitors of MAO-A. Moclobemide and clorgeline are the examples. Second, tricyclic antidepressants. They are further classified as noradrenaline plus 5-HT reuptake inhibitors. Examples are imipramine, amitriptyline, etc. Second is predominantly noradrenaline reuptake inhibitors. Examples are desipramine, nortriptyline. Third, selective serotonin reuptake inhibitors. Examples are fluoxetine, sertraline. Fourth, dopamine and noradrenaline reuptake inhibitors. Example, Bupropion. Fifth, mood stabilizer. Examples are lithium carbonate. Now let's start with the SAR of TCAs, that is tricyclic antidepressants. It consists of 3 rings with 2 phenyl rings fused by a central 6 or 7 membered ring that can be homocyclic or heterocyclic. The central ring can be bridged to form a tetracyclic rings. Second, the methyl linker to the terminal amine must be 3 carbon units and the side chain can be attached by any carbon on the central ring. Third, branching reduces the potency of triimipramine by 100 times relative to imipramine. Fourth, cis form is more potent than trans form. Example, doxepin. Trans form of doxepin is less potent than cis-doxepin. Fifth, substituting a halogen or CN group in third position of either phenyl ring increases selectivity for 5-HT transporter. Sixth, the terminal group has to be amine and it controls pharmacodynamics. Imipramine. It is a tricyclic antidepressant drug. It is analog of chlorpromazine. It is used to treat symptoms of depression. Synthesis. Imipramine is synthesized by the alkylation of 10,11 dihydro 5H dibenz biazepine using 3-dimethyl aminopropyl chloride in the presence of sodium amide and benzene. Mechanism of action of imipramine. It inhibits norepinephrine transporter and serotonin transporter. This leads to inhibition of reuptake of biogenic amines like noradrenaline and 5-HT into their respective neurons. This increases concentration of noradrenaline and 5-HT in synaptic cleft, leading to depressant action. Uses. It is used to treat wide class of depression. Second, attention deficit hyperactivity disorder in children and to treat enuresis. Side effects. Dry mouth, bad taste, constipation, epigastric distress, blur vision, palpitation, sweating. Adverse effects are increased appetite and weight gain, postural hypotension, especially seen in older patients, cardiac arrhythmia, rashes and jaundice. SAR of selective serotonin reuptake inhibitors. First, monosubstitution in para position of phenoxy group by electron withdrawing group results in gain in 5-HT selective inhibition, but bisubstitution or monosubstitution at other places or use of electron donating group causes loss in selective inhibition. Second, introducing ring in the fluoxetine derivatives maintains selectivity for 5-HT transporter but lowers the potency except in paroxetine, which is more potent than fluoxetine. Third, the amino group shows maximum potency when in secondary form, but tertiary amine reduces the potency for 5-HT transporters. Fluoxetine. It is an selective serotonin reuptake inhibitor. Its S enantiomer is 100 times more selective, but R enantiomer is 8 times more potent and has long duration of action. Mechanism of action. Fluoxetine selectively blocks presynaptic 5-HT transporter. It inhibits reuptake of 5-HT and thus gives antidepressant action. Uses. Major depressive illness disorder, OCD, that is obsessive compulsive disorder, post-traumatic stress disorder, premenstrual disorder, bulimia nervosa, panic disorder, and obesity. Side effects. Nervousness, anxiety, difficulty falling asleep or staying asleep, nausea, diarrhea, dry mouth, and heartburn. Adverse effects are rash, itching, fever, joint pain, difficulty in breathing or swallowing. Bupropion. It is an aminoketone antidepressant of the DNRI class, that is, dopamine and noradrenaline reuptake inhibitors. Mechanism of action. It primarily inhibits presynaptic dopamine and norepinephrine transporters. It increases DA and E levels, that is dopamine and norepinephrine levels in the synapse. This gives antidepressant action. Uses. It is used in depression and second-line treatment in smoking cessation. Side effects are drowsiness, anxiety, excitement, difficulty in falling asleep or staying asleep, dry mouth, dizziness, and headache. Adverse effects are seizures, confusion, hallucinations, muscle or joint pain. Mood stabilizer. Lithium carbonate. It is the only drug that has shown to reduce the suicidal tendency in depression. Its actual MOA is not known yet, but the postulated MOA is lithium in therapeutic concentrations blocks the activity of the enzyme inositol 1-phosphatase. This results in the depletion of the neuronal inositol and ultimately decreases the levels of phosphatidyl inositol and biphosphate and its secondary messengers IP3 and DHA. Uses. In treatment of mania, in the augmentation treatment of depression, in the prophylaxis of the bipolar disorder. Side effects. Hair loss, hypothyroidism, nausea, vomiting, leukocytosis, dry mouth, increased thirst, and decreased memory. Adverse effects. Dizziness, low energy, muscle tremors, and diarrhea. These are the references. Acknowledgements. We are thankful to our President Honorable Dr. Shivajirao Jondhle Sir, Secretary Honorable Dr. Geeta Khare Ma'am, and Principal Dr. Nitin Mohire Sir for encouragement and guidance for efficient use of social media and to spread knowledge through making informative videos. Please like and subscribe our channel for such informative videos. Thank you.